Today, the contact tracing ladder finally gets spelled out. Cabinmate, caregiver, air ambulance medic, dinner companion. And where you land on it decides everything.
This is Hantavirus Watch, and we've spent a week hearing the virus explained. Today, for the first time, someone tells us what actually happens to a Hondius passenger: a phone call, active monitoring, or a quarantine facility.
Infection Control Today writes,
why should infection preventionists pay attention to a rare hantavirus cruise outbreak? Because it underscores a critical reality. Pathogens do not follow expected patterns. This case highlights the need for system-wide vigilance, environmental hygiene, and preparedness in high-density travel settings. For IPs, it's a powerful reminder that effective infection prevention extends beyond healthcare facilities and must anticipate emerging risks before they escalate.
Here's what finally caught my eye in this Infection Control Today piece. It's written for infection preventionists, and it gets at what I've been circling all week. Did the Hondius meet an environmental hygiene bar for a rodent-borne pathogen before it sailed, not after 3 people died?
Let's anchor this in the numbers WHO actually put out. May 2nd, a cluster of severe respiratory illness, 147 passengers and crew. By May 4, 7 cases, 2 confirmed as hantavirus, 3 deaths, 1 critical case, and 3 mild cases.
And the illness clock started weeks earlier, April 6 to 28. Fever, GI symptoms, then pneumonia. So this had been moving on that ship long before anyone flagged it.
The framing I'd push on is that headline, pathogens don't follow expected patterns. Brian, a rodent-borne virus on a cruise ship points straight to the reservoir question. Where were the rodents, and what did the sanitation logs look like at embarkation?
Right, and WHO still calls the global risk low, which tracks with the biology. This is Andes, and only a handful of person-to-person cases have ever been documented. So anyone reaching for respiratory pandemic language here is fighting the actual transmission mode. When officials say they're tracing contacts from the Hondius cluster, who actually counts as risky? Your cabin mate, the flight medic, the person 2 tables over at dinner? And how do they decide who gets a phone call versus who gets put in a quarantine facility?
Great question. The short answer is proximity matters, and so does the kind of interaction. But Andes virus matters too. Most hantaviruses, think the sin nombre strain in the American Southwest, almost never spread person to person. You catch them by inhaling dried rodent droppings. Andes is the exception. It's the one strain with documented human-to-human transmission, which is why officials aren't treating this like a routine rodent exposure story, per reporting from AP and CIDRAP. So the higher-risk contacts are the close personal ones. Cabin mates, family members, healthcare workers who had prolonged, unprotected exposure to a symptomatic patient. Flight crews and fellow passengers on the same aircraft as a known case are being flagged too, though Canada's Chief Public Health Officer, Dr. Joss Reimer, described that group, 26 Canadians on those flights, as low risk, per the Globe and Mail. So they get a notification and self-monitoring guidance, not a facility. For the general travel public, officials are saying not to panic, per AP. The complication with the Hondius is that more than 24 passengers disembarked before the outbreak was even identified, so contact tracers had to work backwards across 4 continents to reconstruct who was near whom and when.
So for the Americans specifically, they ended up in an actual federal quarantine facility, not just, please stay home and watch for a fever. What pushed them into that stricter tier?
The CDC was encouraging all 18 U.S. passengers to remain at a quarantine facility in Omaha through the end of a 42-day incubation window. And that clock started in mid-May, per NBC News. That suggests officials decided the uncertainty around Andes transmission called for a more cautious, monitored setting instead of a self-reporting honor system. So the tiered response, low-risk notification, active monitoring, facility quarantine, is being calibrated in real time as case counts and transmission evidence develop. and the CIDRAP report credits that multinational coordination with keeping the general public risk low. If you are on the Hondius or on a connecting flight with a confirmed case and haven't heard from a health department yet, both the CDC and Canadian Public Health are saying, don't wait, reach out to your local health authority.
If Hantavirus Watch helps you stay informed, please subscribe and leave a quick review wherever you're listening. It really helps other people find the show and keep up with the latest updates. We've put links to every story from today's briefing in the show notes, so you can follow up on the items that matter most to you. Take a look when you have a moment. That's Hantavirus Watch for today. This is a Lantern Podcast.